morning. All right, good afternoon. Welcome to Public Health and Minority Health Disparities Subcommittee. It is March the 12th. We have a big bill load and a limited amount of time, so we're going to get through as much as we can today, knowing that we're going to be coming back probably tomorrow morning. And so once again, to our members, watch your email, listen on the floor, and listen when we get to committee. So we're going to hold House Bill 822, and because it's going to be heavily amended, so we're going to hold that bill. Aaron, are we holding House Bill 1051?
Last year.
Because we're waiting on amendments for that.
Yeah, just pending final amendments.
Just pending final amendments. And the amendments speak to the conversation that we had yesterday, correct?
Yeah, it was all the suggestions from the Department of Health from yesterday.
Okay, so we'll hold that bill. Let's go to House Bill 1293, Maryland Department of Health Public Education Campaign on Prostate, Lung, and Breast Cancer Prevention. We did have the discussion yesterday, and we do now have the amendments from the department. So Aaron,
So there is a reprint of this bill that incorporates the amendments that were discussed yesterday. If you look at your reprint of House Bill 1293, bill page 2, it provides that the public awareness campaign will promote screening for prostate, lung, and breast cancer. Language related to the promotion of participation in clinical trials and studies is stricken. And then if you move on to bill page 3, this alters the bill as introduced regarding the department's duties for the public education campaign. It pushes out the implementation date for the development and the implementation date of the campaign. It restrikes the requirement that the department provide 30 days for feedback and comments from the public on the campaign. And and then the language regarding the reporting of the status of meeting measurable goals, it's retained. It's just stricken in the bill and pushed back to a special section later in the bill. And then as for the funding from the cigarette restitution fund, that is now allocated over 5 years for a maximum of $750,000 instead of $2 million, which was how the bill was introduced. So those are the amendments that are in your reprint and that were discussed yesterday.
thank you. Can I have a motion on the amendments?
Move the amendments. Second.
They've been moved and seconded. Any further discussion on the amendments? All in favor say aye.
Aye.
Anyone
Aye.
opposed? Oh, Delegate Hill.
Sorry, quick hand. I just wanted to clarify, I had answered a question yesterday and I didn't know if we got further clarification that the money does not, I had said it does not come out of any of the other funds. It comes out of the restitution fund generally, that there are additional reserves in there. Did anyone confirm that? And if not, I mean, I'm not trying to hold anything up. I just didn't know if we got confirmation. Okay, thank you.
And we'll try and get
Yeah, MDH is on here, but I mean, I can just say the bill as drafted allocates over 6 years now.
Right. I think that was Delegate Chisholm's question, and I don't want us not to be prepared with the right answer. I mean, I proffered one, but I'm not MDH.
I appreciate that. We'll make sure that we get clarification from MDH before it goes to the floor. So thank you very much for that point. Any other questions on the amendments? All right, all in favor say aye.
Aye.
Anyone opposed? Go ahead and raise your hand. Can I have a motion on the bill as amended?
Move the bill as amended.
Second.
All right, it's been moved and seconded. Any further discussion? All in favor say aye.
Aye.
Anyone opposed? Go ahead and raise your hand in the chat. All right, this bill passes unanimously, and we'll make sure that we have answers to the clarification on the funding to make sure that it isn't impacting any other programs. Thank you very much. We're going to move now to House Bill 980. I think we have the Aaron has been doing yeoman's work, which is why sometimes I'm scrambling to say if we have the amendments. But this one we are ready for. Aaron, if you will talk us through.
And this is another bill that was discussed yesterday. There is a reprint of the bill that reflects some of the discussions from yesterday. The bill as amended would require the Secretary of Health within 6 months of receiving specified findings and recommendations from the Opioid Restitution Fund Advisory Council to present to the Advisory Council decisions for allocations from the fund. MDH must post to their website the council's findings and recommendations and the Secretary's decisions. The bill expands permitted uses of the fund to include supporting community-based nonprofit recovery organizations that provide non-clinical substance use recovery support services in the state. By November 1st of each year, any political subdivision that receives opioid restitution funds must report to the Secretary on the amount of money received that was expended during the preceding year and how the money was spent, and post the report to the political subdivision's website.
Do we have a motion on the amendment?
Move the amendments. Second.
All right, they've been moved and seconded. Any further discussion? Anyone need to be heard on this bill? All right, all in favor of the amendment?
Just real quick, we had, so the reporting from the locals on the subdivisions.
Right.
I don't know that that's.
I don't know that we have consensus language yet.
Yeah.
So let's go ahead and vote on these amendments, but we
Okay.
won't vote on the bill until we
Okay.
confirm with the department and with MACO that we have consensus on that.
Okay, thank you.
Delegate Chisholm.
I'm just, I know that Aaron said that we have these reprints, but I can't find the reprints. Were they emailed?
Yeah, it was while you were on the floor.
Okay. All right, I'll make sure of that.
Sorry.
I'm not worried about this bill.
That's this
but-
time of year.
All right, thank you.
So we're going to vote these amendments, but as council pointed out, there is still a discussion on the reporting that's going on between the department and MACO. So we're going to vote on these amendments, but we won't vote the bill yet until we have that final amendment. So any further discussion on these amendments? All in favor say aye. Anyone opposed to the amendments? All right, the amendments passed unanimously. We're going to hold the bill because we have one more amendment, but then we can just vote that amendment in the bill. I want to go ahead and move to House Bill 97. We did not discuss this bill yesterday, but the sponsor has been working with the department to get and with the retailers to get consensus amendments. And she also needs to be in the other subcommittee. So House Bill 97, baby food, toxic heavy metals testing and labeling. Aaron, if you can talk us through the bill and the amendments.
Okay. There's also been a reprint provided from this bill. I think if you move to bill page 2 of the reprint, after line 10, provides that on or after January 1st, 2025, a person may not sell, distribute, or offer for sale baby food in the state that contains toxic heavy metals that exceed the limits established by the U.S. Food and Drug Administration. It also provides that beginning January 1st, 2025, each manufacturer of baby food shall test a representative sample of each production aggregate of the manufacturer's final baby food product for each toxic heavy metal. The testing that's done under this bill must be conducted by a proficient laboratory at least once per month, and a manufacturer may test the final baby food product before packaging individual units of baby food for sale or distribution. At the request of the department, a manufacturer of baby food must provide the results of the testing that's conducted to an authorized agent of the department. And beginning January 1st, 2026, each manufacturer of baby food shall make publicly available on the manufacturer's website for each baby food product sold, manufactured, delivered, held, or offered for sale in the state, the name and level of each toxic heavy metal present in the baby food product as determined by the testing from the proficient laboratory, sufficient information such as the product name, universal product code, or lot or batch number to enable consumers to identify the final baby food product, and a link to the U.S. Food and Drug Administration's website that includes the most recent U.S. FDA guidance and information about the health effects of the toxic heavy metals on children. They also must, if the baby food is tested for a toxic heavy metal subject to an action level, regulatory limit, or tolerance established by the US FDA, include on the label the following statement. For information about toxic heavy metal testing on this product, scan the quick response code and a QR code or other machine readable code that allows consumers to access on the manufacturer's website or the baby food product information page the test results of the toxic heavy metals and a link to the webpage of the US FDA that includes the most recent guidance and information about the health effects of the toxic heavy metal on children. If a consumer believes, based on the information gathered through the use of the QR code included on the baby food label, that baby food is being sold in the state with toxic heavy metals that exceed limits established by the US Food and Drug Administration, the consumer must report the baby food to the department.
Thank you, Erin. If I can get a motion on the amendments, and then we'll open up the discussion.
So moved.
Move the amendments. Second.
Second.
They've been moved and seconded. And we do have Kaylee Locke here from the Maryland Retailers Alliance. And the sponsor, and my understanding is that these amendments conform the bill to similar legislation that passed in California. And with this, we have we are no longer opposed. Is that correct? Am I
That is correct,
characterizing
Madam
that?
Chair.
All right. Thank you very much. Anyone have questions or concerns on these amendments? All right, they've been moved and seconded. All in favor, say aye. Anyone opposed, go ahead and raise your hand. All right, can I have a motion on the bill as amended?
Move the bill as amended.
Second.
Second.
It's been moved and seconded. I have a hand from Delegate Chisholm.
I'm sorry. I was just trying to get back to this. I know the retailers are now in favor. Does that also, I guess, Kaylee, do you represent the Consumer Brands Association as well? Or are they happy now with the amendment?
They are actually a member of ours, and it is in writing to the committee that they are fine as well.
Okay, thank you. Perfect.
Thank you for the question, Delegate Chisholm. All right, the bill has been moved and seconded as amended. Any further discussion? All in favor, say aye.
Aye.
Anyone opposed, go ahead and raise your hand in the chat. All right, House Bill 97 passes unanimously. Erin, do we want to speak to 411 and just give an update?
Sure.
Bill 411.
I can, and I believe hopefully there's people on here as well. This was the bill that would have required a licensed healthcare provider when issuing a standing order for an opioid reversal drug to allow an individual to choose any formulation of any opioid reversal drug approved by the US Food and Drug Administration. It was discussed yesterday that MDH and the advocates, Eric Alley, was working on a study language. I believe they've agreed to once a year for the next 3 years, on or before December 1st, 2024, that MDH will report to the House Health and Government Operations Committee and the Senate Finance Committee on the current opioid reversal drugs that are approved by the Federal Food and Drug Administration, and then for current opioid reversal drugs that have been approved, whether the department has added them to a standing order, and if they have not, why they have not.
So this bill is being amended into a study. I understand that we do have consensus on the language and on the terms of the study or the report, and the terms of the report. Because of time, I'm going to ask if the committee is comfortable with voting the amendments in concept, knowing that they are forthcoming and that we will have them before we have to do the committee vote.
Move the conceptual amendments.
Second.
All right, they've been moved and seconded. All in favor of the amendments in concept, say aye.
Aye.
Anyone opposed? All right, do we have a motion on the bill as amended conceptually?
Move
So moved.
the amended bill.
Second.
It's been moved and seconded. Any further discussion? See, we have complete and utter faith in you, Erin. We know your work. All right, all in favor of House Bill 411, say aye.
Aye.
Anyone opposed, go ahead and raise your hand in the chat. All right, thank you so much. It passes unanimously pending our amendments in writing. We have one more bill today, which we also did not discuss yesterday, because we wanted to confirm exactly what we were doing with it, and that is House Bill 1171. So I'm going to preface this with, oh, sorry, Delegate Alston. You have your hand raised.
I just wanted to acknowledge, I see Delegate Woods joined us. We
Yes,
already
did you all
passed her bill. I
call
don't
my
know if
bill
you
already?
saw that.
Yes, thank you. Thank you,
Yeah,
Delegate Alston. We
we
did.
passed it.
Your bill passed unanimously.
Yeah, just didn't want her
Oh,
to have to
thank
sit
you. I'm
through.
so sorry. Thank
No,
you
you're
so
good.
much.
Thank you, Delegate Alston, for pointing that out. I appreciate it.
Thank you, Delegate.
So this bill, House Bill 1171, non-prescription drugs and devices provision by registered nurses and sale of contraceptives through automatic devices, is in two pieces, the criminal law provision and the health law provision. And Aaron, if you want to talk us through the reprint, and so that the subcommittee has clarity on what we're doing. Because it's a little confusing.
Okay. Yeah, there is a reprint that's been distributed. So the bill has two parts. There's the part under the criminal law article and the part under the health general article. It's the bill as introduced under the criminal law provisions would repeal the prohibitions against and the related penalties for selling or offering for sale a non-latex condom by means of a vending machine or other automatic device, and selling or offering for sale a contraceptive or contraceptive device by means of a vending machine or other automated device at specific school sites. And then the second part of the bill under the health general article deals with the Committee on Registered Nurses personally preparing and dispensing drugs and devices in local health departments, which is an existing committee. So the bill would include additional information on the non-prescription contraceptive drugs and devices approved for over-the-counter use within its formulary. And then the bill is introduced, would authorize a registered nurse to provide non-prescription drugs and devices without a prescription. And there is an amendment that was suggested by the Department of Health that appears on bill page 3. And this prohibits a person from selling or offering for sale a natural membrane condom by means of a vending machine or other automatic device.
Thank you. So you'll see in your reprint that there are parentheses around 10 -105. And we're at that's current law. It's not a problem. We were trying to modernize the law, but I think given the time constraints, we're just going to not address that. But we didn't want to strike it out and confuse everyone. So the bill will it will address the repealing the non-latex condoms. At the time of this statute, there were no natural membrane condoms. There were no non-latex condoms that were not natural membrane. There are now many options for people with latex allergies for vegan condoms. So we want to update that part of the statute to recognize that we have that. And we also want to be able to focus on protecting our nurses from censure by the board for providing over-the-counter medications. So I wanted to clarify what we're actually doing with this bill, and then ask for a motion on the amendments, and then we'll open up the discussion.
Move the amendment. Second.
All right, they've been moved and seconded. Are there questions on the bill as amended? Delegate Chisholm, followed by Delegate Hill.
So right now, all of this is legal in a school system. The only thing we're changing is the non-membrane to
So
is a-
right, so right now, 10-105 is current law, and that's why we don't want to change current law. that is, the current law is a person may not sell or offer for sale a contraceptive or contraceptive device, whether or not advertised as prophylactic by means of a vending machine or other automatic device at a kindergarten, nursery school, elementary school, secondary school. In practice, that's not happening, but given the time constraints, I think trying to repeal that provision could actually confuse the public and this body. So since what we want to do is modernize the first provision, recognizing that there are now vegan options for people with latex allergies, we will only be repealing in the criminal law 10-104.
Okay, I think I got it.
All right, thank you. Delegate Hill.
Yeah, thanks. So maybe I was out for the bill hearing and I didn't see the, why is it that it's okay to repeal the latex, but it's not okay? I mean, why are we making it illegal to do the natural? Why is it not okay to do either type of condom? Why are we making a distinction?
My understanding is the natural membrane are more subject to environmental impacts and also have an earlier expiration date. So having them in a vending machine could mean that they're not as efficacious if we put them in a vending machine.
So why is that not up to the vendor owner who is, in other words, if I've got chips that are going to expire in a month, I may not put the chips in there, right? I may decide to go with something that's longer. Why is that not up to the vendor to decide if they can actually put them in there? Is it concern that people will, because then the vendor's liable for having things that have expired in the machine, right? Why are we taking that on?
I think this was at the suggestion of the health department.
Okay.
Because it was mirroring best practices. And Delegate Williams is nodding her head. Delegate Williams, do you want to?
So if I can, yeah, so I want to just be clear. So what that means is if you have a latex allergy, you will not be able to get a condom at a vending machine. So you're going, because we don't trust that you know what it is, because people carry condoms around and, are going to have to figure out whether it's expired or not, right? Whether it's in a vending machine or in their pocket. So why are we saying people with allergies are not allowed to make the same decision about it as we're saying people who don't have allergies?
Delegate Hill, I'm going to address it, and then I'm also going to turn to Dr. Kalyana Raman. The repeal that we're doing is to expand access to people with latex allergies, because there are now non-latex vegan options, and that's why we're repealing that part of the statute. Is because
So
we have expanded.
Are you saying the non-membrane are separate from the non-latex? So
Correct.
there's 3 categories?
There are 3 categories. There are vegan, there are vegan condoms.
Not a contact. I assume the vegan were the same thing as the natural membrane, but they're not, is what you're saying.
They're not, correct.
Okay, thank you. That helps.
They do not use natural membranes. So thank you.
Thank you. Okay, that's all I need to know. Thank you.
Thank you, Delegate Hill. Delegate Hutchinson.
Thank you, Madam Chair. Just for the purposes of my understanding in this bill, contraceptive devices, are we just talking about condoms?
Yes. And Robin Elliott is nodding her head. Yes.
Thank you.
And Dr. Kalyana Raman, is there anything that you want to add that I missed in the discussion?
No, I think you've covered it. The one thing I'll add is that the natural membrane condoms aren't effective in preventing STI transmission in the same way that latex condoms are, but there are also non-latex synthetic condoms now that are both appropriate for latex allergic individuals and are effective in both STI and pregnancy prevention. So that's the language shift from when it was first done to now that we're trying to get at.
Thank you very much. Delegate Hill.
Yes, so what is it in here that prevents a sponge or other devices other than condoms from, which I think would be fine, but you and Miss Elliott said that it's only for condoms. Why would this not include like a sponge or something like that? Some other non-prescriptive, a sleeve, a vaginal condom. it's more than, it can be more than condoms, right? There are other non-prescriptive contraceptive devices, right?
And I'm gonna turn to Robin Elliott.
Thank you, Delegate Hill.
Great question.
So condoms would include male or female condoms, although female condoms are technically over the counter. The manufacturer now only makes them available by prescription, which is too bad for availability. I do think you're right. Technically, you could have a sponge. And I should have thought of that. Apologize, Delegate Hutchinson. There is also for medication does include spermicide. So spermicide's over the counter, but it's considered a medication. And so, but from what we've seen in other states where this is available, what's really available in vending machines are condoms.
So overwhelmingly, but not exclusively. Okay.
That's right.
Yeah, I think that's accurate. In practice, that's what we're seeing, but the law does not prohibit other over-the-counter devices. Let me go to Dr. Kalyana and then Delegate Chisholm. Actually, Delegate Chisholm, go ahead and ask your question because Dr. Kalyana may have the answer.
Perfect. So what we're doing here is we're not really expanding areas or anything like that. We're just expanding variety. Am I correct on that?
You are absolutely correct. When the statute was originally written, there was no option for people with latex allergies that was not a natural membrane.
Okay, thank you.
Thank you, Dr. Kalyana.
To address Delegate Hill's question, part of what we're focused on is both the STI and the pregnancy prevention. And a number of the methods you're talking about are really focused only on the pregnancy side of things. And so I think the point of this is that if you're getting your contraception out of a vending machine, it's likely that you need STI protection as well, right? A lot of the other contraceptive methods are probably much more appropriate in a variety of other settings. We're really just talking about the vending machine space.
But it's not just the Department of Health who's putting these, right? Or did I miss that? Are these vending machines only available through the Department of Health, or can't any private vending owner decide that they're going to supply whatever they want to supply, right?
Yeah, that's correct. Are there any other questions on the amendments? All right, the amendments have been moved and seconded, I believe. Yes, everyone can. So on the amendments, all in favor say aye.
Aye. Aye.
Anyone opposed? All right, if I can have a motion on the
Move
bill.
the bill as amended.
Second.
Second.
All right, it's been moved and seconded. Any further discussion on the bill as amended? All in favor say aye.
Aye.
Anyone opposed, go ahead and raise your hand. All right, the bill passes unanimously. That is the last of our bills. Today, we did hold a few bills. So just stay tuned because we've had the discussion. So hopefully we can just move the bills once we have all of the amendments. Delegate Riley.
Yes, I'm sorry. I had to come in late because I was testifying on another bill. Can you tell me which ones we held? So I'll know.
Okay, we held House Bill 822, House Bill 980. We did vote the amendments, but we have one more amendment pending, so we did not vote the bill. And we held House Bill 1051 because we just don't have all the amendments yet to put in front of everyone.
Okay, so then the other three left, we voted.
We voted, yes, we voted 97 unanimously, 411 unanimously,
And
1171 unanimously, and 1293 unanimously.
Thank you very much. I appreciate that.
Certainly. Thank you so much. With that, I'm going to give you 15 minutes back. Thank you all for doing all the hard work. I know things are moving quickly, and please get some food. And I will see you in bill hearings.
Move to adjourn.
Thank you. It's been moved, it's been seconded, and we are adjourned.